couple more folks coming in. Welcome to the Children's Mental Health Matters webinar series. My name is Angie McRae. I'm the Child and Family Engagement Manager at the Mental Health Association of Maryland. Today's session is being recorded and will be made available to you in the coming week. Our speakers today are Lauren Gage, founder and CEO of Triplemoon, and Dr. Katie Sardone, Chief Clinical Officer. And today they'll be talking about solving the pediatric mental health gap with collaborative care. With long wait lists and overwhelmed practices, families often can't access mental health care when they need it most. In this session, you'll learn how the collaborative care model solves that gap by bringing coordinated, evidence-based behavioral health directly into primary care, improving outcomes for kids and easing the burden on providers. A little bit about our speakers today. Lauren Gage is the founder and CEO of Triplemoon, a virtual integrated behavioral health platform designed to make expert mental health care easier for families to access. Her family's own experience navigating early parenthood inspired Triplemoon's mission to bring high-quality, evidence-based support directly into primary care. Dr. Katie Sardone is the Chief Clinical Officer at Triplemoon and a clinical health psychologist specializing in clinical health psychology and healthcare consultation. She provides supportive, evidence-based care for a wide range of medical and mental health conditions and regularly collaborates with multidisciplinary healthcare teams. Lauren and Dr. Katie, thank you so much for being here today. I'll turn it over to you.
Thank you, Angie and Audrey, and the broader Mental Health Association of Maryland. We're so grateful for this opportunity to be here today, and more broadly to talk about the state of mental health in the U.S., specifically as it pertains to pediatrics, and how Triplemoon is uniquely positioned to help address not only the patient needs, but also provider needs as well. You've already done such a wonderful job with our introduction, so I'll spare you those details. We can move right into it. And we'll also, we're excited to take any questions that come. We'll hold those for the end. We'll have plenty of time though, and it's a relatively intimate group. So would love to, open it up for dialogue after we go through a few slides here. But to start off, we would love to just, acknowledge a reality that you as primary care providers are living on a day-to-day basis. It's never been harder to be a PCP, and Triplemoon was created to really change that dynamic. If we go to the next slide, we know that one of the biggest issues in primary care are the treatable mental health conditions that families are not able to address. And that frankly, as a primary care provider, there just isn't enough time in the day to get through all of the physical health considerations of your patients, much less provide the full spectrum mental health services that patients are demanding. We know that primary care is the front door of mental health in the US. Your patients are bringing these issues to you. And the resources around you are not sufficient. And that's really where Triplemoon comes into the picture. I'd say the most important statistic on this page is that 1 out of every 5 children in the US get sufficient access to mental health services. And really, when we talk about collaborative care and the primary care environment, when we bring collaborative care into the primary care environment, we're really able to change that statistic and that dynamic and get children the mental health care access that they deserve. On the next page, we're excited to introduce you to Triplemoon and our mental health services. So Triplemoon is a 100% virtual integrated behavioral health service, and we really specialize in pediatrics and the family system. We partner with primary care providers like you to provide evidence-based behavioral health support with the overall goal of helping every family and provider add years to their life and life to their years. We want patients to be happier, healthier, more productive citizens in this world. And one of the best things about Triplemoon and about the collaborative care model more broadly is that unlike traditional care, we'll talk about the difference between collaborative care and traditional therapy a bit more in a bit more detail. But one of the best things is that these CPT codes and this model of care is covered by insurance, including Medicaid, which means that when you're visiting with a patient, you don't have to be doing the mental gymnastics around which patients are eligible and able to enroll in the services. So if we go to the next slide, we're going to dive a bit deeper into what collaborative care actually is. Oh, sorry, we have one slide before that. Talk a little bit about what the Triple Moon objectives are. So we have three main objectives, and the first is really focused on improving patient outcomes. We do this by providing access to our behavioral health team within 48 hours of referral. And if you think about traditional care, patients are oftentimes waiting 6, 8 months to get access to a provider. With Triple Moon and with collaborative care, integrated behavioral health, patients are getting into service within that first 48-hour window. Unlike traditional therapy, collaborative care is also a treatment to target based behavioral health program. And what that means is that as patients are diagnosed with a mental health condition and enrolled in care, we are using a very specific and evidence based care pathway to drive meaningful step change in outcomes, typically within a year of enrollment. So we are seeing patients graduate from our care back out into the world, happier, healthier, more productive citizens. Our second objective is really around increasing primary care provider capacity. And I would say this is another big difference between collaborative care and treatment as usual. We are very focused on not only the patient, but also you guys as providers and the clinics. So by working with a collaborative care business like Triple Moon, we are able to take those, really difficult to manage long-term behavioral health considerations off the plate of the primary care provider and allow you to practice at the top of your license. And typically, providers that work with us save on average of 11 hours per week. That can be used for, better quality of life, work-life balance, thinking about taking on more patients, spending more time with your existing patients. 11 hours per week is pretty significant amount of time. And then last but not least, practices really benefit from the increase in revenue that collaborative care allows for. And this is as simple as by providing collaborative care services through your clinic, you're able to bill 3 new CPT codes that wouldn't have been possible before. So when we get into what collaborative care actually is and how Triple Moon deploys this with our primary care partners, there's really 3 components to the care team. Starting with you as the primary care provider, you remain in that kind of quarterback role, managing the relationship with the patient, determining who is eligible for behavioral health care. But what you get by adding a provider like Triple Moon to your team is really those 2 resources at the bottom of the triangle. So first and foremost, our team of behavioral health care managers. These are licensed clinical social workers with significant experience managing the behavioral health needs of the pediatric population in particular. These are the folks dealing day in and day out with questions from mom and dad, actual behavioral health treatment of the patient, and everything in between. And the second resource that's really valuable is the psychiatric consultant. And the psychiatric consultant is part of our interdisciplinary care team. And part of the role that they play is helping you as a primary care provider with medication management. And so they review every single case that comes through the Triple Moon metaphorical doors, if you will, and helps us not only with the care planning and the behavioral health components, but also looks at the medication that you're either already prescribing or that could be prescribed to help unlock the behavioral health treatment of that patient. At the end of the day, you as the primary care provider still make the determination as to whether or not you write that script, but you're doing so with a lot more evidence of the board certified psychiatric consultant. If we go on to the next page, we'll dive a bit deeper into what collaborative care services look like in the Triple Moon model. So every patient that works with Triple Moon has the benefit of 4 core services. The first is behavioral health intervention. So this is your therapy style services, again, leveraging our evidence-based care pathways, our treatment to target approach. Those care pathways determine how frequently we visit with each patient, the types of behavioral health intervention they receive, who on the team is working with them day in and day out. And that is most similar to care as usual therapy style services. The other 3 pieces of the puzzle on this page are what makes collaborative care very different from therapy or care as usual. So, in addition to getting that therapy, patients are also getting the benefit of care coordination. And this is really hands-on support across for patients that require it, any social determinants of health, so local social resourcing. But we also go into the school and work with the parents on any school accommodations. Perhaps if a child is getting therapy or services through the school, we would work with the parent on coordinating that into the broader behavioral health, physical health needs of that child. And we also work with the family and with you and your team on any third-party referrals with other subspecialties and making sure that those families are able to get into those appointments, show up for those appointments, whether it be OT, PT, speech. And this is really, really helpful, especially with the neurodivergent autistic population. This is where we're really holding the hand of every single parent and making sure that they have an extra partner in that journey. On the bottom left-hand side of the page, Triple Moon also does quite a bit around family education. So unlike, traditional therapy where the child is the main focus, right, they're receiving the benefit of those services, Triple Moon serves not only the patient, but also the broader family. And we know that oftentimes family education is really important in helping a child with their behavioral health diagnosis. Everything that we do, and Katie can talk a little bit more about this, is rooted in attachment, in an attachment-based curriculum. And so we are working day in and day out to help families strengthen that parent-child bond, sense of confidence, security in the world that we know is so important for everything from academic achievement to just interpersonal relationships later in life. And then last but not least, we touched on this a little bit before, but as part of the collaborative care model, our team of board certified psychiatrists are working with our full team of social workers, psychologists to make med management recommendations. And so, this is as basic as, the right prescription at the right time in the right dosage, but also medication adherence. And so we're working on what types of things we can be doing with that patient to make sure that they are actually taking the medication that's prescribed, which can oftentimes be tricky in the pediatric population. If we go on to the next slide, I'm going to hand it over to Katie to talk about the types of diagnoses that are appropriate for collaborative care. And I'll hand it over to you, Katie.
Thank you. We can see a variety of different diagnoses in collaborative care. Really, any mental health diagnosis that is common in a primary care setting that's our bread and butter. So, the top row here are probably our most common referrals for pediatric behavioral health, anxiety, depression, adjustment disorders with the combination of the two, ADHD, autism. We get a lot of general developmental concerns as well, but we can see a variety of issues. We often work with feeding or picky eating concerns, parent or sibling conflict concerns, lots of just general behavioral concerns that come up at school or at home. And we can support all of those things through the specific care pathways that we discussed, but also through that family curriculum. Our family curriculum does support the treatment to target approach, but it also discusses things outside of the typical care pathway, like toilet training, school refusal, bullying, different things like that we know impact the main diagnosis as well. So we really take a holistic approach there. And the patient has to have a diagnosis to be referred in, but it doesn't have to be accurate. We can support that if you say, I think we're real specific. I think it's in general this mood concern. We do a very thorough evaluation at intake. There's a battery of screeners that we provide that are developmentally specific by age and by symptom. And then after the full evaluation from the licensed behavioral health care manager, the patient will be put through an interdisciplinary case review, including psychiatry, doctoral level psychology, additional social workers, and nutrition, a registered dietitian. And we look at the patient as a whole and we say, okay, Yes, as a team, we agree with this case conceptualization. These symptoms make sense. This treatment plan makes sense. This care pathway makes sense. Let's make sure to do X, Y, and Z. And all of these things, all of these recommendations are written down into a concise document and put right back into the medical record for the PCP. So you all can see our case review and how we envision treating the patient and can follow along on the journey as well. So let's take a look at the patient journey from the patient's experience. So uh, at the point of at any point, so in a visit, or if a patient calls in is talking to your nurse about a concern, you all can refer that patient in. When they come to us, they're going to get that intake screening that I just mentioned, and we're going to evaluate. We're going to make sure we have the correct diagnosis and look at their age. And in that process, we're going to not only look at their symptoms, but we're going to stratify by severity in order to make sure that they're on the correct pathway with the correct frequency. And by the way, during all this time, we're also matching to the correct BHCM because we think a clinical and personal fit is really important for the success of the behavioral health intervention. And then once they're on their pathway, they're going to receive those interventions you just saw, those four core services. So behavioral intervention, family education, care coordination, so connecting to community resources as needed, addressing SDOH needs, bringing in other providers as needed to really leverage that team approach. And then all the while, we'll be collaborating back and forth with the PCP on med recs, adherence discussions, et cetera. And that cycle continues until graduation. So we do, our goal is to graduate patients out. Our goal is to not keep patients forever. And we can really do that in the CoCM model. And there's really great research demonstrating the efficacy of this model, which we'll talk about in a minute. But we have specific criteria to graduate families out. All right, so we want to go over just a typical case of what it really looks like for you all and for families. So let's use this child, Jordan. Jordan's a 10-year-old who presented for his annual well check on a Tuesday. In that visit, his mother reported concerns about difficulty focusing at school, recent behavior changes, and periods of anxiety. So, this is probably a very typical patient that you see. And just from that report alone, you can send the case over to us, and we can just pick it up from there and provide the necessary screens, and we're off to the races. But you may also, in this case, have a screen that flags Jordan for anxiety, let's say, or something like that. Or you might have previous notes that might identify him as a concern. So there's a number of different ways to flag those concerns. Um, so in that visit, you refer the patient to Triplemoon. That the same day, the patient can be scheduled for their intake on, let's say, a Thursday, so 2 days later. And in the initial meeting, that in-depth intake evaluation, Jordan and his mother confirmed the possible diagnosis of anxiety and that history of difficulty focusing, impacting functioning. And in that evaluation, we'll have those in-depth screeners that will be evidence for these concerns and will use as the foundation for their treatment planning. Jordan's BHCM, again, these are master's level licensed clinicians, social workers, LPCs, create a comprehensive treatment plan for Jordan, including weekly behavioral health interventions focused on coping, anxiety management, executive functioning support. They gather an ROI to enroll Jordan to discuss with the school and enroll Jordan in psychoeducational testing to achieve a formal diagnosis of ADHD and rule out any other learning disorders that might be interfering with his functioning. They get an ROI to collaborate with the school counselor to set up an IEP plan and make sure that all the elements of ADHD and anxiety are being addressed appropriately at school. They are also receiving that interdisciplinary case review, which happens for every single patient on our team. And in that, they're getting those medication recommendations and the monthly screening of these tools. So we don't just kind of on the front end, do this comprehensive evaluation, get the diagnosis, and move forward with treatment. At that point, we are systematically bringing them back up into the interdisciplinary review at various points to check in with the whole team for progress and also gathering monthly um, information on their symptoms, reevaluating each month for symptoms and patient satisfaction, engagement, different factors like this. So you can see with these examples why there's such significant evidence that the CoCM model is so powerful. So there's over 90 randomized controlled trials that support CoCM as effective for treating a variety of behavioral health conditions, and often over treatment as usual. So for example, with adolescent depression, symptoms, one study showed that symptoms at 12 months have been improved. So 50% of those cases were improved at 12 months while enrolled in CoCM compared to 20% improvement for treatment as usual. And it's not hard to see why these additional services that are often left out in the typical referring out to mental health model are really foundational. It really takes the whole system together in this treatment approach to get the benefit that these family needs. So we've talked about all of this, but I think it's helpful just to kind of see this visual when you compare a CoCM model like Triplemoon to treatment as usual. So in both cases, you're getting that therapy style approach. I would say the quality of that approach is a little different. Obviously, traditional therapy, when you're referring out, you don't really have eyes on what's happening after they leave your office. With Triplemoon, you do have eyes on it, and you know that with our treatment to target approach, we are evaluating consistently and actually making sure that what we're doing is working. Because if it's not working, we're going to pivot and do something different. They're getting that monthly interdisciplinary review as part of the service. You don't have to find all these different providers and try to get them together, which is incredibly expensive and time consuming. That's all under one roof here. Um, and then there's no wait list. So for the traditional therapy route, it can take sometimes several months to get into a provider that is within network. And if not, out-of-network expenses are extremely high, typically. The sessions, also the way in which we conduct these sessions, the length and the frequency is designed to be much more flexible so that patients can actually access these services. In a traditional therapy model, which has its place, but it's very structured. It's typically a 60 or 45, 50-minute session weekly in person. It brings up a lot of barriers for a lot of families, like childcare, transportation. How do we balance this with other obligations? So our model allows for sessions that can even be as short as a 15-minute phone call in between sessions to remind a mom the coping skills that were learned last time. So we meet the family where they are in the time frame that they can engage with. This is also an integrated service. So it really is, we are really wrapping these services around the PCP, and the PCP does remain the head of these services. And so all of this is visible to you, not just in your EMR, but also you're a phone call away for talking to the psychiatrist, talking to me, talking to the BHCM. We're all here working as a team together. And then the structured family education is also huge. So this is something that patients can leverage for a variety of different needs and return to anytime that they want for maybe even issues that they're not on that pathway, right? Maybe a mom just a child is being addressed in the neurodivergent pathway, but then something came up with school bullying or something came up with some other need, and we can just pull that information and have it ready for the family. Um, the care coordination is obviously something that's not part of the traditional therapy construct, which does move the needle for a lot of these families. And actually, this piece right here is a huge unlock for the clinics. This is actually where that administrative time that you get back is largely here, that you and your team are no longer making a million phone calls and waiting on hold forever to try to find these services. We just take that off your plate and we do that for you. Um, and then the cost differential. So Triple Moon, these are primary care CPT codes, and so families are paying the cost of their copay, one copay per month, as opposed to sometimes several $100s of outpatient therapy fees in a traditional therapy model. And then finally, we provide support for the PCP and the clinic, both operational and clinical support, which Lauren will chat more about in just a moment.
Thanks, Katie. And yes, up until this point, we've been very focused on the patient care, the behavioral health, the patient journey through collaborative care and in working with Triple Moon. But as Katie just highlighted, a big part of our model is really focused on unlocking time savings, quality of life, and just general benefit for the clinic. And so what we're going to do now is transition into a little bit of what does it look like to work with Triple Moon or in a collaborative care environment on a month-to-month basis. And then we'll talk a little bit about, the benefits for the clinic. So, as Katie mentioned, everything, if we look at the upper left-hand part of this slide, everything starts with you as the provider identifying a patient for referral. And Triple Moon does support this, right? We oftentimes have clinics that will give us direct access into their EMR. We use that to drop notes and other details about patients, but we can also help support referral identification using our understanding and knowledge of patients who are at a higher risk for behavioral health considerations or behavioral health needs. We always want to get patients before the crisis. So when they're mild to moderate symptomology, not when they're, moderate to severe. But it all starts with that referral, and you as the primary care provider ultimately make that determination. That referral comes to Triple Moon in a variety of different ways. One of the first things that we do with every clinic is get to know your culture, your ways of working, what technology, electronic health records you're using, and we set up a process that fits your need. So that referral may come through eFax to Triple Moon. At the point of intake, the patient would be reached out to within the first 48 hours and scheduled with their BHCM almost immediately thereafter, and would go through that initial intake screening. And this is where we are confirming the diagnosis, making sure that there aren't any secondary or tertiary diagnoses, and then enrolling them in the care pathway and protocol that Katie walked through before in step 3. And so as soon as they are enrolled, they have their initial meeting with their BHCM, they are receiving all 4 of the services that we've gone through: the behavioral health, the care coordination, patient education, psychiatric consultation, the interdisciplinary team review every single month until they are ready to graduate, which is a joint decision between Triple Moon, the patient, and of course you as the primary care provider. On a monthly basis, on a daily basis, really, Triple Moon is taking copious notes about every interaction that we have with our patient, all the screens that we're running, any coordination with school or other providers, and we're documenting that copiously. And then at the end of the month, we provide that full medical record back into your electronic health record. And again, the way that we do that, the mode, really depends on what EHR you're using and your preferences. We can fax it back, right? We can drop it natively within the system, really whatever your preference is. And that gets the full record back into your view so that the next time you see that patient, you not only see your own history, but you see everything that Triple Moon is doing. And this is a huge unlock for a lot of providers who are used to referring out and not knowing what happens to their patient. This is going to give you a ton of transparency and clarity. Throughout the month, this is not the only time that you hear from us when we drop records back into your EMR. We have a series of touch points that we make available to the provider team, the admin team, the billing team, and these touch points are voluntary. We find clinics opt in, opt out, kind of at their leisure. But again, we make ourselves available so that, as you have more complex patients or perhaps medication questions, that you have the opportunity to work with our interdisciplinary team throughout the month and ask questions. And this is also where we present back to the clinic more of a population health view of how the patients are progressing through their care. At the end of the month, we also provide a full snapshot of the billing record. And we'll get into, the billing in just a minute, but collaborative care is a behavioral health model meant for primary care. And so the CPT codes are primary care CPT codes that are billed by the primary care provider. Triplemoon provides all the details, the time spent with the patient, the exact codes to bill, the supporting language, but the primary care team ultimately submits to the payer and manages the payer relationship and the reimbursement. Triplemoon separately charges a flat fee for service, and we'll get into that on the next slide. What all is included in that fee and how we think about the value creation for the clinic. And so in working with Triplemoon or working with a collaborative care player, you are getting not only the support, the end-to-end support for patients, all the things that we've just talked about, the diagnosis support, the clinical treatment, access to our team via text, video, medication management, care coordination, social determinants of health, family education. But that we spend a significant amount of time and really value the relationship with the clinic and with the provider team. And so as part of the relationship with Triplemoon, we have a dedicated clinic success team that works day in and day out with the clinic, really on demand to provide very personalized support. From anything from helping you think about how to, communicate and market collaborative care services to your patients through clinical training and enablement. We get, very much into the weeds on topics like safety planning, on universal screening, postpartum mood and anxiety disorders, which we know often present themselves in a pediatric setting, and really, base those touch points on what the provider team in the clinic needs. But we are very attentive to ensuring that the provider team feels supported. And then, of course, on an ongoing basis, we're doing all of the patient risk and chart reviews with the provider team, supporting any referral identification, enrollment, population health review, access to our psychiatric team. And then, of course, at the end of every quarter, we'll sit down and do more of a formal look back, quarterly business review. So how is your panel performing in terms of their behavioral health improvement? What is, patient satisfaction, provider satisfaction look like? And all of that, right, is included in this one flat fee for service that the clinic is paying Triplemoon. And that flat fee is a per patient per CPT fee. We don't charge any upfront onboarding costs. There are no referral minimums, no additional overhead or hires needed on the clinic's behalf. Triplemoon really does take care of all of that. And then from the patient's perspective, I know Katie hit on this a little bit, but one of the main benefits to patients is that unlike therapy, where they may be paying anywhere from $60 to, $200+ per session, collaborative care is the cost of the patient for collaborative care is one primary care copay. So, $20 to $40 a month for the duration of time that they're enrolled. So a significant cost savings, which really does speak to improving the access for patients as well. If we go on to the billing side of things, and this is, of course, something that we review in detail with every single clinic or prospective partner. But just to kind of to hit this at a high level, collaborative care billing is a time-based billing construct. And so there are 3 new CPT codes that you are adding to your billable stack. And the only difference between those 3 codes is the month of care that you're in and how much time is being spent with each patient. And again, our job as your service provider is to keep track of that time. And then at the end of the month to tell you which CPT codes need to be billed, and provide all the supporting evidence for that reimbursement. In the state of Maryland, one of the most wonderful things and why we're excited to be in Maryland is the really strong reimbursement history. And so this is not only the case for commercial patients, but also for Medicaid patients. And this just means that we're able to serve a much broader population in a more scalable manner. If we skip ahead to, what does this look like, right? When you factor in the reimbursement from payers, the fees that are charged by Triplemoon, what does this look like for a typical provider or a typical clinic? And of course, this is something that we would prepare very individualized for every clinic, but there is a significant amount of economic benefit that clinics gain by onboarding collaborative care. And really what this comes from is not only being able to bill the primary care or the collaborative care CPT codes, but also the time generated by that clinic to either take on additional patients, which means you're able to bill for other types of services, as well as the improvement in no-shows. So we know that where patients are enrolled in behavioral health support, they are more likely to show up for their primary care visits. And so as a clinic, you are adding significant amounts of revenue to your bottom line, somewhere in the range of $30,000 to $70,000 per provider per year. And of course, this varies tremendously based on how many patients are referred and your unique reimbursement rates and everything along those lines. But this is just to give you a flavor of what we see pretty typically. All right. So just to hit a little bit of, collaborative care as a whole, right? We are here to advocate for this model in general. Collaborative care is truly an unlock for providers and patients. But when we talk about Triplemoon more specifically, why do clinics partner with us? It really comes down to the level of service that we provide, not only to patients on the right-hand side of the page, we have an 86% patient satisfaction score, but also to providers and to the clinic as a whole. So our providers, consistently tell us that they are benefiting right from the revenue generation, from the time savings, from the ease of billing, but also from our end-to-end support model and really the high level of service that we provide. And then, of course, on the patient side, they see the benefit in Triplemoon's unique pediatric experience and expertise that Katie and her team bring to the table, the kindness of our BHCMs, and just having that additional partner in the parenting process. Of course, access to the behavioral health resources is huge, but all of those other services, the care coordination, the family education, understanding what medication and how to give that medication is such a huge unlock for families. And we're very grateful to be able to provide these services. On the last page, before we open it up for questions, if this is a service that you are interested in learning more about, we would love to chat with you. There's a QR code here you can scan on your phone. We'll also share the details with Angie and Audrey afterwards for how to get in touch with our team. But it's a very simple process. We will prepare a financial forecast and a proposal for your clinic. We'd love to get to know your clinic, just how you operate, what your values are, and what's most beneficial for you. But as soon as we have, those details nailed down and a short contract in place, you're able to refer your first patients. And typically that onboarding timeline can happen in as quick as a few weeks. So that brings us to the end of the formal presentation. If we go to the next page, there are some contact details there, but I think we can pause, and Angie, if it's okay with you, we'll open it up for questions.
Absolutely. Just feel free to unmute yourself and ask, or if you want, you could raise your hand. You put
Or
it
type it in the chat.
Yes, good morning. My name is Sandra Aljami, and I'd like to know, where are you located?
It's a great question. So our team isn't entirely virtual. Katie and I are both based in Dallas, Texas. Our team of behavioral healthcare managers is truly nationwide. We hire the best talent. And then, of course, part of what we're doing is ensuring that they're appropriately licensed in the states that we're operating in. We are active in Maryland.
Okay, thank you.
I see a question in the chat. Will these slides be available? Yes, more than happy to make them available. There's also a ton of detail on our website, which is just www.triplemoon.com.
Are there any additional questions for Lauren or Dr. Katie? Nope. Okay. Thank you so much to Triple Moon and Lauren and Dr. Katie for being here with us today and sharing this information about the collaborative care model. We want to thank all of you for joining us today during your lunchtime. You will receive a follow-up email with a link to the recording as well as the presentation and a survey for feedback so that we can continue to bring you interesting topics and continue to improve our webinars. Join us next month for our children's mental health webinar on February 19th at 11:30 to 12:30. The topic is Serve Your Community by Supporting Others, and it will be hosted by the Child and Family team here from the Mental Health Association of Maryland. We'll share practical insights and best practices for building meaningful, effective support groups in your community. Also,
Thank you so much,
exciting news,
Angie.
we're just days away. Oh, okay. Thank you. We're just days away from kicking off the Children's Mental Health Matters campaign, so be on the lookout for how you can join the campaign this year. Our past champions can attest to how exciting the campaign can be and how impactful. You can start your advocacy efforts now, however, by sharing our annual poster contest, and we'll be sure to put that in the follow-up email. And we look forward to working with all of you to support families and communities across Maryland. If you have any questions, feel free to reach out to info@cmhm.mhamd.org. Thank you all.